In the spirit of reconciliation, DHSV acknowledges the traditional custodians of the land that we are filming on and their connections to land, sea and community. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Welcome to the DHSV Coffee Catch-Up series, where we shine a light on key oral health issues to spark discussions that lead to change. Migrant and refugee communities face numerous barriers to accessing healthcare services, including language barriers, cultural differences, previous trauma, lack of familiarity with healthcare systems, and limited financial resources. These challenges are compounded when it comes to the oral health because oral health services are often not prioritised in general health settings. By providing more accessible and patient-centred oral health care, we can address these barriers and ensure that migrant and refugees receive the dental care they need when they need it. To talk about this and a whole lot more, I'm joined today by Fatemah Osman, a final year dentistry student at La Trobe University with a passion for public health advocacy. Fatemah has completed a Bachelor of Biomedical Science and a Diploma in Business and Leadership and is driven to empower women and minorities in the field of dentistry. With over a decade of experience in community development, she actively supports first-generation Australians, migrants and refugees in overcoming the unique challenges they face. Alongside her commitments as a student dentist in rural Victoria, Fatemah manages her role as a devoted mother of 2 young children, while also running her own business and excelling in her studies. She's also served as a committee member for the Australian Dental Students Association and as Vice President of the Islamic Society of Deakin University. Well, Fatemah, thank you for joining me on the couch. That's an amazing resume that you've got, an amazing piece of work. How do you fit all that into a day?
Yeah, it's quite a lot sometimes, but I guess you can never really get that balance right. So sometimes, you try your best, and I've got supportive community around me, which is always really helpful. But yeah, I think it's really important to give back, and that's something that I really value. So thank you for having me today.
So, what has inspired you to become a dentist? Why dentistry?
It's interesting that you say that. So I, growing up, really wanted to be a lawyer at one stage. And that was something that I was quite adamant about. Even my parents were like, okay, that's going to be her path. And then as I sort of navigated through 11 and 12, that sort of changed. I thought the health field would be something that's a bit more, I guess, sort of strung my values and my values a bit better. And so I think dentistry came into the picture a bit later in my studies, so I did a biomedical science at Deakin with the hope of becoming a gynaecologist, and women's health was really important to me. And then just sort of life just took me a different path. I met my husband, who's a dentist, and I really, really enjoyed dentistry through his sort of lens. And then, I find myself now in my final year of the dentistry course, and it's something that I think is just so aligned with, my values and pretty much.
Well, as we say here at DHSV, good oral health means good health. It's a really important part of how we actually were improving the health of the Victorian community, is making sure that oral health is in a good place. What do you think are the major barriers and challenges that migrants and refugees find about getting into the health system or the oral health system as a patient, but also as a student? What are the barriers for people to actually become a dentist or finish a university degree?
That's a really good question that you ask. I think so. The work that I do with the migrant community, I also have some sort of lived experience of the migrant world. My dad came in as a migrant in the late 80s, early 90s. And so as a first generation Australian, there's a lot of lived experience as well. I think the major barriers, a lot of it's, I think, education. Prioritising oral health isn't always something that's discussed within migrant populations. Obviously there's also language barriers, cultural barriers, financial barriers. So it's a whole sort of mesh.
It's not one thing,
It's not one particular thing. But I think something that really strings to my attention, especially through I actually posed this question to a lot of my community members in a recent event, and a lot of it was financial to them. I think that's something that's a really big sort of deterrent. But then again, there's not much awareness of all the public initiatives that are available.
Yeah.
A lot of migrant communities have, concession cards and things that they can use, but I think being able to express that and educate that those sort of initiatives do exist. Also health insurance, that's something that's, not talked about, and sort of dental benefits that are associated with that. So those are some of the barriers I think that are preventing.
So from a migrant community point of view, is there ways that we can access that community differently to actually provide that information in a more meaningful way? I mean, I know that cost is a massive barrier for basically every Australian in relation to oral health, but is there a way that we can improve the way that we communicate with different communities to actually get the information out there about what's available and what they're eligible for, and also, what are the actual real costs? Because everybody just goes dentistry, ooh, expensive, but I think often it's the great unknown that does stops people from turning up.
That's right. Representation is key, and so inviting people of colour, and so it's something that I advocate for all the time. Representation, seeing someone that looks like you, has some sort of, lived experience as well as knowledge about the sort of things that you're experiencing. You relate to that person a little bit better. So representation is one. Collaborating is really good. Collaborating with local organisations that are sort of hands-on and know what's happening the day in and day out within these communities. I think that's something that's really important to put at the forefront when tackling migrant and refugee sort of initiatives. Language as well, sort of promoting and sharing information in the native languages of the communities that you're targeting is really, really important. Being really visible is also key, I think. Attending events, speaking to leaders within the communities at a regular basis, I think is really important. Local councils, things like that, I think
Fantastic. Where do you think we've gone wrong in the past in relation to helping communities to access healthcare?
I think first I'd like to acknowledge that there is a lot of work that is being done behind the scenes. It's great to see. I think in the past we haven't had many representatives of the migrant communities at the forefront. I think having someone come in that is different. Sometimes I think it's looked at an issue of trust. How can I trust this person if I believe that they don't really know what it is that I'm experiencing? That's something that's quite big, I think. So I said representation, and I think barriers to language are really important. Young first generation Australians are really, really good assets to initiatives like this. You've got sort of the best of both worlds, I guess. That, they've got access to, all that lived experience from back home and their families, and also they're the connection from people that are,
honestly, I don't think we use that group as well as we should. Because you're right, they have direct connection to family and community, but also, have a better understanding of how, things work in Australia, because you've grown up here, you've been to school here, you understand how some of these systems work. So, good tip. We will definitely be targeting people like yourself. You talked about language barriers and cultural barriers. How can some of those be overcome, do you think, as we try and engage communities in a better way?
I think maybe even starting with dental schools, incorporating that as part of the curriculum. I think it is addressed, so we do have subjects and units that do discuss cultural competence and literacy, but I think it's more of a theoretical concept. Having more opportunities to be able to go out there and apply what it is that we're learning as students into community. I think is really important. That's something that I think we're lacking. I'm from La Trobe University, so we are a rural school, so we do have a lot of placements in areas where there is marginalised communities. But I think that there's just that extra step that I think if it was implemented, you'd get more of a foundation there.
And it might not necessarily be that we need to go into community and do treatment as such, but it might be even a student experience going into community to teach people about good oral health, as we were talking about earlier, brushing techniques, what sort of food you should be eating, those sorts of things. I think is potentially an option for our students, rather than necessarily being having to take a clinical chair or all those other bits and pieces. May well be a good way to start.
Yeah, exactly. Getting those communities out there to the universities as well.
Yeah,
I think is really important. Just listening to stories.
Yeah.
Stories are really good ways of connecting with people.
Yeah.
Yeah.
Storytelling a really important part of how you change culture and you change the way that the world works. Can you share an example of a successful initiative that you've been a part of? Because I know you've been a part of an awful lot of things in your community, and why was it successful?
Yeah, I think a lot of initiatives that I've been sort of involved with, I'm really passionate about engaging migrant communities in the dental field. There's an expo that I'm regularly attending on an annual basis as part of the organisation Ubuntu. And so it's a career expo where they showcase all the African members of community that are involved in various fields. I represent dentistry quite often, my husband and I. And so through that experience and exchange, I've been able to, I'd say, recruit.
Well done.
Yeah, lots of people.
Yeah.
And I get messages constantly saying, I'm so glad that I spoke to you because I'm in this field now.
Wow.
Or I'm trying to get into this field, and so thank you. So for me, representation is something that I think we need to tackle, get more people on board our profession. And it's worked. So, you can see people coming in.
That's
nice.
fantastic.
Yeah.
And so that conversation about you can't be what you can't see. So
yeah.
Oh, well done.
Thank you.
To improve access to oral health, we need to expand our workforce. You're in your final year of dentistry now. How do we actually improve the value proposition for public oral health? A lot of your colleagues will go into private practice. A lot of the other university students that come through our system will end up in the private sphere. How do we make public oral health fun, interesting, exciting place to be?
Yeah. So I'm not sure about the research and the statistics. I know that being placed at a rural school, we've been told that majority of us graduate and go into private practice anyway. So I think there's a need that needs to be addressed here. I think perspectives of my colleagues is that the pros of going into public is that you get access to sort of more diverse populations that you wouldn't otherwise get in a private sort of world. I think the pros as well is that you get to work in sort of areas where underprivileged, and that social impact is quite, I think, encouraging for people that are looking for public. I think to increase interest would be offering mentorship opportunities, or getting people that are working and benefiting from the public sphere to come and share their experiences to students, increases their incentive. Getting the success stories to come out and share, because you get a lot of the private world, that marketing is quite high, and so they're very visible. Being able to showcase that success can also happen in the public sphere. I think also financial incentives, things like scholarships for students, relief of loans. Those are the things that I think a lot of the students discuss. Collaborating with dental schools, getting a representative out there. I think it's really important.
Do you think that that students, as part of the clinical experience that you have during your time at university, is it more beneficial, or does it feel like it's more of a team work situation when you're out in clinical practice, or are we still really siloed, that the dentists do what the dentists do and the therapists do what the therapists do, or is it starting to feel a bit like a team sport rather than an individual sport?
I think my personal experience is saying that, yeah, it is starting to look like it is a team sport in my perspective. I think benefits of when I entered the dental school, sort of our first year of dental school, we had subjects that were sort of in parallel with oral health students.
Yeah.
So we sort of did the same coursework, got exposed to what they learn, and they've gotten exposed to what we learn. We've got more of an understanding of their role and other people's roles within the dental team. No, I think it's changing. It's shifting.
Yeah.
But then again, I'm not too sure once I start, to start work out how that sort of looks. But yeah, from what I can see, I think it is more collaborative.
Yeah.
I think more opportunities of work in the public would be great. Often we find that in the public roles, even personally in my friends when we apply, it's always, you don't have a dental assisting certificate or things like that. So we have to go out of our sort of way to get those qualifications to be able to work publicly. I think, getting our foot in the door would be, a really good opportunity.
Yeah, we have talked about, is there ways that we can, instead of, as you say, to become a dental assistant, you have to go and do a certificate 3 and you're already studying, so why would you do that? And in other disciplines, as you progress through the years of your university degree, you actually have clinical skills that you're actually able to go and work in a health system to be able to actually practice your craft, but also learn how the health system works. So it is one of the things that's on our agenda to have a look at and see if there's a way that we can actually support students as they're going through the system, because I'd much prefer you guys all working in my health system rather than working at McDonald's or the local grocery store or wherever it is that people are working to.
Or private dental. A lot of us do work privately.
Yeah.
And so you sort of get in that sort of career path.
Yeah, you're kind of forced into that space.
Yeah, exactly.
Yeah. If you had a magic wand that you could change, whatever it is that you would like to change, where would you like to see oral healthcare go in Australia, particularly in relation to your lived experience?
I'm probably going to be a little bit out there and say that I think there needs to be major reform in the way that the public sort of, or even just generally, Medicare policies, I think, need to sort of lend a hand to the dental arm, I guess, of healthcare. Yeah. We see that a lot of allied health professionals, there's a lot of Medicare that's covered, whereas, dental's still sort of way behind.
I'm working on it.
Yeah, and it's really great to see. I think that's going to be a major, disruptor to all the challenges that we're facing as a community. So, major reform in that regard. Yeah. I think, grassroots level, I think private practices need to be a little bit more pro bono, try to do things for the community and not for the dollar. That would be, I guess, what I would do if I had that magic wand. Excellent.
Well, Fatemah, thank you so much for spending time with me this morning. It's been an absolute pleasure hearing about your experiences, but also, it's great to have a young, almost graduated dentist thinking more broadly about how we can improve the oral health or even just the healthcare system for your community. So thank you so much for your time.
Oh, I appreciate it. You're doing wonderful things for our profession, and we're very, very grateful for the opportunity to speak today and to meet you in person. It's really great, so thank you so much.
Thanks a lot.